Hello, I'm Dr. Saroja, specialist in physical medicine and rehabilitation at Akkineni Hospital. Wishing you good health. Today, we'll review some important points. Please stay engaged and take notes.
Look, we've all been there, right? You pull something, you sprain something, and immediately the first question that pops into your head is, how long is this going to take? We all want to get back to our lives as fast as possible. Well, what if I told you the answer isn't just about waiting, but about actively helping your body heal? Let's get into it.
For the longest time, the go-to advice was always the same. Just rest it, put your feet up, and wait. But it turns out that might not be the whole picture. In some cases, too much sitting around can actually slow things down. So the big question is, can you play an active role in your own recovery? The answer is a resounding yes. Okay, here's the best way to think about this. Imagine your body is a master builder, an expert, and right now, the site of your injury is a full-on construction zone. This builder has a super detailed blueprint for how to fix everything perfectly, and you're the project manager. Your job is to make sure the builder has all the right tools and materials to get the job done right and maybe even ahead of schedule. So let's take a look at this official blueprint. What's the plan? Well, this whole construction project happens in three main phases. They kind of overlap, but understanding each one is the key to knowing exactly how you can help move things along. Here's the game plan in a nutshell. First up, you've got the inflammatory phase. Think of this as the demolition and cleanup crew. Next is the repair phase, which is all about laying down a brand new foundation. And finally, you have the remodeling phase, where all the finishing touches are made and the new structure is reinforced to be super strong. Let's dig into each of these. All right, let's talk about inflammation. We're all taught to think of it as the enemy, right? The swelling, the redness, we just want it gone. But here's the thing. It's not the problem, it's the start of the solution. It's your body's emergency response team rushing to the scene to clear out all the damaged stuff. Without this crucial first step, nothing else can happen. It's messy, but it is absolutely necessary. Okay, once the site is all cleaned up, the real rebuilding begins. This is the repair phase, and it can go on for a few weeks. Your body starts pumping out this amazing protein called collagen. That's basically the scaffolding and the concrete for your new tissue. At the same time, new blood vessels are being built to act as supply lines, bringing in all the materials needed for the job. And that brings us to the final and honestly the most important phase, remodeling. This is the long haul. We're talking weeks, maybe even months. That new tissue that was just built gets reorganized and strengthened. Those collagen fibers start lining up in just the right way to handle stress. This is where you build real, long-term strength. And trying to rush this part is how people get hurt all over again. So if our body has this amazing blueprint, why does it sometimes feel like an injury is taking forever to heal? Well, just like any construction project, you can run into delays. There are some really common roadblocks that can totally slow down our master builder. So what kinds of things can throw a wrench in the works? Well, think about it. Poor circulation? That's like the supply trucks getting stuck in traffic. The materials never make it to the job site. Not eating right? That's like asking the crew to build a wall without any bricks. And if you keep straining the injury, that's like having a saboteur on site, knocking things over every night. All these things directly get in the way of the body's repair plan. But here's the good news. We can absolutely do something about those roadblocks. We can be a fantastic project manager. So let's open up our toolkit and look at the things we can do to support our master builder and actually speed this whole thing up. This one is so important. For sure, a little rest right at the beginning is good, but locking down the area and not moving it at all for weeks, that actually makes things worse. It causes stiffness and makes the new tissue weaker. On the flip side, gentle, controlled movement acts like a quality control expert. It gets the blood flowing, prevents everything from seizing up, and helps make sure those new collagen fibers line up properly for maximum strength. And you have to remember this. Rebuilding parts of your body takes a ton of energy and resources. It's hungry work. You can't expect your body to build a brand new, solid structure if you're not giving it the raw materials. You have to fuel the project. So, what's on the shopping list? Protein is the #1 non-negotiable building block for pretty much all tissue repair. Vitamin C is absolutely essential for making that collagen scaffolding we talked about. Zinc helps keep your immune system, the cleanup crew, working at its best. And if you're dealing with a bone injury, vitamin D and calcium are your best friends. And let's not forget two of the biggest superstars, sleep and circulation.
Think of sleep as the overnight construction crew that comes in when everything is quiet. It's when your body releases growth hormone and repair kicks into high gear. And circulation, that's the delivery service, the fleet of trucks bringing oxygen and all those nutrients right to the site. And you know what helps both of them? Gentle movement. And what hurts them? Doing nothing at all.
Now, part of being a good project manager is also knowing when a job is over your head. You gotta know when it's time to call in a specialist, a project foreman, like a doctor or a physical therapist, to make sure everything stays on track.
So, when do you make that call? Here are the big red flags. If the pain just isn't getting better after a few days, that's a sign. If swelling isn't going down, if you're really struggling to move or put any weight on it, definitely make a call. And this is a big one. If you keep injuring the same spot over and over, something's not right, and you need a pro to figure out why. Okay, this might be one of the biggest mistakes people make. The second the pain is gone, they stop their rehab and go right back to what they were doing before. But listen, just because the pain is gone does not mean the job is done. The remodeling phase, remember? That takes a long time. Stopping early is like walking away from the construction site when the walls are up, but they haven't been secured. You're just asking for trouble down the road.
So at the end of the day, the real goal isn't just to stop feeling pain, it's to finish the entire project. True recovery means you can get back to doing all the things you love, without fear, without hesitation, and with total confidence in your body. So the real question is, are you giving your master builder everything it needs to build you back stronger than before?